everyone, welcome to NG's Corner for nurses. Hope all of you are doing well. So we are in the last session of anatomy of female reproductive system. If you want to review previous sessions, then please go through the links given in the description box. So let's start the anatomy of an accessory reproductive organ, that is anatomy of breast. And this is the outline of today's session. The breast is the tissue overlying the chest muscle. That means overlying the pectoral muscle. It present bilaterally in pectoral region. Breasts are modified sweat glands. In males and immature females, breasts are rudimentary. And after puberty, female breasts are fully developed. And women's breasts are made of specialized tissue that produce milk. It extends vertically from 2nd to 6th ribs and horizontally from lateral border of sternum to mid-axillary line along 4th rib. The breast lies on top of the pectoralis major muscle. So the mammary gland rests upon the following structures. The pectoralis major is a large fan-shaped muscle which forms the base of the breast. Then the serratus anterior and external oblique aponeurosis also contribute to the overall structure and support of the chest wall and breast area. The pectoralis major we can found in the medial 2/3 area. The serratus anterior we can found in the lateral 1/3 area. And external oblique aponeurosis we can find in the inferior medial quadrant. Each breast has two regions, circular body and axillary tail. The circular body makes up the bulk of breast, and we can divide this circular body into 4 quadrants, upper inner and upper outer and lower inner and lower outer. And then the axillary tail. It runs along the inferior lateral edge of the pectoralis major towards the axillary fossa. Next, coming to the structure of the breast compound. The structure of breast is divided into skin, parenchyma and stroma. The skin covers the gland and presents a conical projection which is known as nipple, which is situated at the level of 4th intercostal space, and nipple is pierced by 15 to 20 lactiferous duct. Skin around the base of the nipple is pigmented and circular, and it is known as the areola. In areola, there are sebaceous glands which are known as Montgomery tubercle. It keeps the skin around the nipple lubricated during breastfeeding, and it enlarges during pregnancy. The parenchyma is made up of glandular tissue, and each mammary gland is made up of 15 to 25 lobes that radiate around the nipple. You can see in the picture. Each lobe is made up of lobules which are formed by various acini. The lobule contains group of milk secreting glands called alveoli. And near the areola, each lactiferous duct dilates to form lactiferous sinus, and the glands drain into the lactiferous sinuses which open onto the nipple. The stroma is the supporting framework of the mammary gland. It is made up of fibrous as well as fatty tissue, and it supports lobes and forms septa. What is septa? Septa is the fibrous connective tissue structures that divide the breast tissue into lobes and lobules. These septa are also known as suspensory ligaments of Cooper. Suspensory ligament of Cooper maintains shape of breast, separates secretory lobules, and secure breast to skin and underlying pectoral fascia. Now, what is pectoral fascia? Let's see the picture. Pectoral fascia is a sheet of connective tissue associated with pectoralis major, And what is retromammary space? It is a layer of loose connective tissue between the breast base and the pectoral fascia. Next, coming to the blood supply of breast. First is arterial supply. The breast is supplied by the branches of internal thoracic artery, lateral thoracic and thoracoacromial arteries and posterior intercostal arteries. And the venous drainage mainly into axillary vein and some may drain into internal thoracic vein. Next, coming to the lymphatic drainage. From the outer part drains into the axillary nodes. From the upper part to the supraclavicular group of lymph nodes. From the inner part into the parasternal nodes and internal mammary nodes. And from the lower part communicates with subperitoneal lymphatic plexus and drains to subdiaphragmatic lymph nodes. And the nerve supply, the breast are supplied by branches from 4th, 5th and 6th intercostal nerves. If this content is useful for you, then please put a like and share it with others. And for getting more videos like this, you can subscribe my YouTube channel NG's Corner for nurses. And for any suggestions or for any queries, you are most welcome to comment. Thank you for watching.